I get the easy job because I get to introduce the people who everybody here and everyone in the world knows. We've got the founders of the largest foundation in the world, and the two most important philanthropists in the world right now. $300 million towards vaccine and treatments, more than $1 billion to production distribution, more than $1 billion to Gavi, with more to come. But Bill and Melinda Gates are putting tremendous amount of time, money, and brain power towards solving this scourge. We appreciate it. We appreciate you guys joining us.
Thanks for having us.
Please. And I love the couch. Before we get into, I really want to focus obviously on COVID, but before that, Melinda, actually, you made some news this week with Mackenzie Bezos, your announcement about the Equality Can't Wait Challenge, that you're putting $30 million into, basically to challenge ideas to move the needle in terms of gender equality. Can you maybe talk about the genesis of that and why you're doing this now?
Sure. I believe that we have to get gender equality here in the United States. It is imperative, and there are several barriers that hold women back. And we have to really, if we're going to bring women up, we have to invest in things to help them with their power and their influence. If we invest in 4 key sectors, such as politics, finance, tech, and media that tells our stories, and we started to get gender equality in those 4 segments of society, we would change society at large. And so Mackenzie and I have been talking about this actually for quite some time, and this happened to be the right time to make the announcement. But we're looking for bold new ideas of how do you actually move gender equality in the United States. And so we thought this platform, Lever for Change, was the perfect place to announce that. And we will start to see candidates come forward, and we'll make some prize-winning announcements hopefully next summer.
Okay, guys, we just had Dr. Stoffels talking about timelines. It's the biggest question in the world, and you guys are right at the center of it. When are we gonna have, whether it's a therapeutic or a vaccine, but when is the world going to be able to get back to normal? You guys are running point on it. Help.
Well, hopefully one of the 3 vaccines that are furthest along end up being both safe and efficacious. The Moderna went into human trials first, then the Oxford AstraZeneca, and then the Johnson & Johnson that you just heard about from Paul Stoffels. And so the animal data gives us pretty good hope that one of those will work. Doesn't look like they'll work as a single-dose vaccine, probably a 2-dose vaccine. If those don't work, then there's about a 6-month gap before you'd get the other candidates coming forward. And so to have one in the first half of next year, it'll have to be those 3. And we are quite hopeful and working in parallel to get the manufacturing capacity, not just for rich countries, but for the developing countries, where actually right now, the majority of the cases are not in the rich countries anymore. They're in South America, Africa, Southeast Asia, including India, sadly seeing a big increase.
Yep. So maybe you could delve into that, because there's so much public focus on, okay, we have the vaccine, but it's not even halfway there, because if we don't immunize, if we don't get herd immunity, or we don't get a large majority of the world immunized, then we really haven't beat this. So what's the timetable on that?
Well, if you say that you've got to get, say, 80% of the world's population with the 2-dose vaccine, that's over 10 billion doses. The 2 of the constructs, the AstraZeneca and the Johnson & Johnson, are pretty scalable in their manufacturing. That is, you can do single plants that turn out over 600 million doses per year. And so we're going around the world and saying, okay, where do we reserve? Where in the US, Europe, India, China, where do you get that capacity? Which, if both AstraZeneca and Johnson & Johnson work, you can actually see a plan that's starting to come together that we'd be able to make over a 2-year period, pretty close to that many doses. But it won't be overnight, and so you'll have a 2-year period of manufacture if things go well. you will have to have some prioritization of who's at the front of that line and who's not at the front of that
Yeah,
line.
I think one thing that's really important to say about these vaccines is the two that Bill's mentioning at the top of the list, the Oxford AstraZeneca one and the J&J, do not require cold chain. And that is huge for the world. Whereas the Ebola vaccine and some of these other ones that are on the list do require very difficult cold chain, like minus 80 Celsius. And that is very difficult in many places in the world, not impossible. One of the reasons we're so involved in this is that you don't want the first vaccines to go to the highest bidding countries. You need to make sure that there's equitable distribution. So if you just look at healthcare workers around the world, there's 60 million healthcare workers. They deserve to get the vaccine first. They're the ones dealing with this on the front lines, trying to keep us all safe. And then you have to start to tier from there based on the countries and the populations. But you know, here in the United States, really, it's going to be Black people who really should get it first, and many Indigenous people, as well as people with underlying symptoms, and then elderly people. They're the ones who all deserve to get that vaccine first.
Well, that makes sense. So how do we make that happen? Especially how can philanthropy help, or is it only government policy? How do we get to that necessary place?
Yeah, we've had a lot of philanthropists come in on this in various ways, including what we call the Therapeutics Accelerator. Number of generous philanthropists have helped support that. Philanthropy can move a little bit quicker, support things that haven't gone through the same complex process. In the long run, the really big funding, as you're getting up into many billions, that will be governmental money. But the idea of getting the right scientists, the early candidates backed, getting the factories done in parallel, philanthropy will have played a key role. You know, we helped fund a trial in the UK that you just saw came out with a corticosteroid, dexamethasone, that showed really good results. And you know, that trial network had been set up several years ago to be ready for an epidemic. That's not a complete solution. It's about a 20% reduction in the death rate, but it's a step, and there are other things, including monoclonal antibodies as therapeutics. It'll come out even before the vaccine is fully available.
And I think
One
thing for philanthropists to understand is we are lucky as a world that we have two institutions. We have this Gavi, which is the Vaccine Alliance that was created 20 years ago. That is the mechanism that the rich world governments, I know you're doing a panel on this, have been giving money to. And that's our pull mechanism to pull the vaccine through and get it out to countries. It's amazing how the pharmaceutical companies are working together in ways we've never, ever in 20 years of doing this work have seen before. So we have that fund as a mechanism. Private philanthropy can come into that fund. It's really, really helpful. We put a lot of money into that fund. There's another fund, which is the Global Fund, which gives AIDS, tuberculosis, and malaria medicines around the world. Again, that's been set up since the time of President Bush. And that fund is very good at getting medicines out. So they will be the ones to help us get a therapeutic medicine out all over the world equitably once one's available.
Well, that's always key, again, for philanthropy not to be redundant either. So if we're talking about Global Fund, Gavi for distribution, tell us about your work with production. You guys have put a lot into production, and how that could be a model for other philanthropists in terms of trying to help in that middle ground. We have the vaccine, and then we have the distribution, and then in the middle you have the production, and you're focusing on that too, and how philanthropy can play a role there.
Well, normally you get a medicine approved, and then you can start to build up the manufacturer. Here, because the impact on people's lives and the economy is measured in the trillions, the idea of putting forward at risk a small number of billions to shave a few months off of that availability, it makes sense. Now, exactly who should do that is tricky. And so we've been trying, talking to other funders. Usually the United States plays a role in global problem solving. So rather than withdrawing from WHO, they'd be involved collaborating with other countries, not just trying to, cast blame. So it's a tricky situation where the U.S. has sort of turned inward on this one. There are some good things happening in the U.S., and so we're trying to stitch the different country efforts together. The European leaders are trying to fill that vacuum. So we don't yet have it all in place. If those two vaccines are successful, we can start to see how it could come together. But we also need to back a few other candidates in case though there's some problem. We won't really know about side effects until we go through those large trials.
Well, it's also, this is a great example. I mean, philanthropy, and you two have been at the forefront of this, sometimes requires failure. And this is a case where we're going to go down roads that are expensive and necessary to get us to the other side. So I think that's a great point. Yeah, Bill, you mentioned, the U.S. Should we be, and we've got, I guess, 189 philanthropists on this call right now, probably 2/3 Americans. Should we be optimistic? I mean, a lot of America's opening up. A lot of America's getting back to work, but then you look at Florida, Texas, Arizona. Should we be feeling good or not so good right now?
Well, sadly, the death rate is probably not going to go down much from where it is. Hot weather helps. And so as you get back into October, the force of infection will go back up again. The current death rate, which is still pretty serious, about 800 a day, that is benefiting from the seasonality. And people are becoming more lax in general, both the policies and the behavior. And so it's hard to see, even though it'll get a little bit warmer here for a bit, the death rate's not going to go down much. And so Dr. Fauci's statement that, hey, we're still in this first wave that will get more intense as we get into the fall, that's, what everybody should assume. Until we have a miracle therapeutic, which the only one that has even a chance of that would be the monoclonal antibodies, or we've got the vaccine out, this thing will be stalking the land. And, the U.S. has chosen not to be as strict as most of the Asian countries, particularly China, but also some of the others who started out early. They've gotten their number of infections down to very small numbers, whereas the U.S. still has a pretty gigantic number of infections.
Yep. Now, Melinda, I've heard you talk about disaggregating data. So tell us why that's important and how that can help bring solutions to the right population.
Yes, so we have to have disaggregated data. Otherwise, we wouldn't know who's being disproportionately affected with this virus. And it helps us understand where to apply resources. And so we are just in the process with our many disease modeling organizations that we work with, trying to get that data from the states. Not all states have it and have it in a way that we can use it. But if we can use that data, then we know to say, okay, this is where we need to make sure we apply the resources. And quite honestly, apply the vaccine first. The testing, the therapeutic when it becomes available, and the vaccine. Those are going to be the hot spots and where you're going to want to go to help affect the most change for this country. And I have to say, it is why you've seen Bill and I be a bit critical of the current US government, just because if we were doing testing today, our only tools today are social distancing, masks, and testing. And so if we had been doing testing in the right national way, we could be more in the shape that Germany's in, where you test and you do contact tracing. That is going to be really, really important and continue to be important through the fall when we see this next big wave of this epidemic coming through.
So what we've heard from you guys is the second wave is a when, not an if. And with that in mind, all right, so President Trump, finds religion, calls you guys and says, what should we do? What is the game plan? If you had to give us an elevator pitch that this group can spread to the world here in the States about what a more effective policy would be.
Well, just usage of masks alone makes a substantial difference. And the compliance to mask usage in South Korea, China, Japan, it's very impressive. In the US, partly because of the lack of leadership examples, our mask compliance is actually not very good. You know, a mask is not that expensive. It's not that ugly. You know, and so when you're in those situations where you're near to people, it should be used. You know, we're learning more and more about testing capacity is going up. If we can get it, some breakthroughs on testing scale and target it appropriately, particularly anyone who has contact with older people or those at greater risk, it will help us bring the numbers down. But, you know, we don't know, are we going back to say 2,000 deaths a day like we were in April? That's hard to say. It's possible that we will. You know, so 2020 is going to be a very tough year because the US just hasn't been willing to drive the numbers to the same low level that many other countries did.
Yeah, so the elevator pitch is test, contact trace, isolate and quarantine, and wear a mask, and role model wearing a mask. Every single person should be wearing a mask without exception.
We spent the first half of this session talking about equity and opportunity. Let's talk about that in the context of COVID and how this, you know, how this affects us, again, around the world, but especially here in the States, based on race and gender. There are differentiations. And maybe, Bill, maybe you could handle race and Melinda gender, but maybe you could delve into that a little bit.
Well, yeah, it's certainly troubling that where the disaggregated data's come through, it does show not only the age thing, which is number one, and the comorbidities at number two, but also a significant racial component. And that's likely to be multifactorial, partly general health condition to begin with, partly job type, household size, multi-generational household, you know, living in the dense parts of the urban areas. And, you know, we're also looking at, you know, all sorts of medical things. What is it that we can intervene to cut this down? So if in advance, if you'd asked, would there be different outcomes by race, we would not have expected that. It's a, you know, stunning and disappointing result that we're seeing in many countries. The UK has seen this as well. For a while, the disease did not take off in Africa. Sadly, it looks like that was just a delay in it getting going because now, despite the younger age mix, the cases in South Africa and other parts of Africa are taking off, even somewhat behind Asia and South America, but still with a very, very scary trend. So, you know, there's a lot to be done on the intervention side to reduce that exposure, to prioritize the protection that the inner city communities deserve on this.
Yes, and I was just going to add on the race. I think also it's exposed for us the gaps in our healthcare system. You know, you are not treated equally in this healthcare system, and that is something that needs to be fixed. On the gender side, I think, again, it's exposing the gaps that were already there that we so often as Americans don't want to look at. So just to give you some statistics, women are losing their jobs at a disproportionate rate to men. A lot of it has to do with the sectors that women work in, like retail and hospitality. But even as people start to go back to work, fewer women are coming back to the workforce as a percentage compared to men. So those are the statistics for the United States. Now, the other issue that's going on is we know women are doing 2.5 more times unpaid labor at home. And they and their husbands are reporting that when it comes to teaching the kids, trying to make sure they're online, fixing the meals, cleaning up, babysitting the kids, caring for the elderly, women are doing that more at home, whether you're a white collar female worker or whether you're a person who lives in the inner city and you get on the bus to go to your job. And so what it means is that we cannot reopen this economy the way we want to unless we deal with the unpaid labor. And we are the only industrialized nation in the world that doesn't have a paid family medical leave policy. That's just the truth. And so we have it now in 8 states and in DC. We finally have it for federal military workers. And you saw Congress address this in 2 of the stimulus packages. But we have to update our thinking and realize that we're not in society anymore where the man, if it's a 2-person headed household that's married with a child, it's not that the man goes off to the work and the woman stays home with the children. That was what was going on at the mid-century. But today, of most married families with a child, 64% of them both go out and work. So if we're going to take care of the family and take care of capitalism and the economy, you've got to address that issue. And it is absolutely addressable. Many, many countries have done it with finesse. There are many great policies out there. In the United States, it's time we did it.
And we say, many people taking credit for the saying, never let a good crisis go to waste. And I think you are seeing movement in terms of public opinion on that. Speaking of public opinion, let's talk about public trust. We seem to be in a strange kind of post-science moment where all this amazing work as Steve Forbes and Mike Milken were talking about warp speed to get to a vaccine, but a vaccine is only so useful if people don't take it or don't trust it. What do we do about that?
Well, there's certainly a lot of misinformation. It's great people are paying attention to vaccines in a way, but a lot of that's the false data. We'll see as the vaccine comes out. We don't need absolutely everyone to take it, but we need a pretty high percentage to take it to get the protection that eventually brings this epidemic to an end. And then things like going to a big stadium will be reasonable to do again, which we shouldn't be doing that right now. So the digital era has brought a lot of misinformation, and with the pandemic, vaccines in particular, I hope that's not getting out into the mainstream.
It's interesting. We have such a short memory as a country, but look, we lived through something scary like this. It was called polio, and it affected so many families in the United States where they were terrified, for good reason, to let their children go out and play, because we, at the time, didn't know where polio came from, and then we had to wait for the Salk and Sabin vaccine. Once those vaccines came out, people lined up in droves for those vaccines. So my hope is that this time will eventually remind people the importance of public health. We forget in this country that diseases like measles are way more infectious than COVID-19 is. I mean, for every person who gets measles, they tend to infect 8 to 9 other people. It is so infectious. We could have another one of those come along. So I'm hopeful that, as the vaccine comes and people do start to use it, it will quell down some of these kind of silly conspiracy theories that are out there.
Well, speaking of conspiracy theories, how are you guys doing personally? I mean, you're now both the subject of a lot of these conspiracy theories. You're doing amazing work and putting a lot of time and money and effort into it. And then this is to some degree what you get. How is that personally affecting you both?
Well, the disinformation is it's confounding on the one hand. And on the other hand, we're still just putting our heads down and doing the work. It doesn't change our daily life to have those conspiracy theories out there. We know they're not true. They certainly come up a little bit with the kids in the household. By the way, we do have our son came home early from college, and unfortunately for him. So that conversation comes up, but it doesn't change what we do on a day-to-day basis, luckily.
Bill, you look a little bit bemused.
Well, I hope it remains a humorous thing, that there aren't anything more that comes of that. It's not like we're going to back off or anything. Some news channels have been better than others on these things. And, it just shows there's certain primal concerns about medicine and science and experts that when people are worried, they're kind of more open-minded to unusual explanations.
Yeah, I think there's look, there's a lot of anxiety for good reason in the country right now, and a lot of tension, and people are more glued at home. They have more time. So in some ways, maybe this was inevitable, but I know my husband is not vaccinating people and putting a microchip in her arm, because that technology doesn't even exist, and he's never uttered the words out of his mouth. So,
so speaking, of other tricky issues right now, you guys mentioned WHO. Clearly the world has never needed that organization more, and yet it's become a political lightning rod. And listen, there are a lot of things a lot of problems there too. What can we do to forge a consensus in this country here in the States? I'm sure you've got a lot of people around the world that kind of shaking their head a little bit, but how can we forge a consensus to not make this a controversial issue?
yeah, so one thing I want to say even before we answer the question is, we thought long and hard about whether to speak out in favor of WHO. And we knew we were going to come under attack, but it was the right thing to do. We know this institution. We've worked with this institution now for 20 years. It is not perfect. It's not even close to perfect. But it is what the world set up after World War II to deal with things like this pandemic. And so it is caught now between the tensions between the United States and China, those geopolitics. But we felt as philanthropists, it was incredibly important to put our voices behind a partner we know to be true but imperfect. So that is why we spoke out. As to what others can do, I don't know. Do you want to take that?
Well, at some point there needs to be a responsible plan for how the U.S. cooperates with other countries about health things. WHO is involved in smallpox eradication, and the U.S., our relationship with WHO is key there. Polio, we are close. We're down to just a few countries. That's very much WHO, where both our money, U.S. money, other countries give to that. And so, you hope that in terms of protecting people's lives, there eventually is a serious discussion about how the world works together. Even this issue of getting the vaccine out, we're hoping the U.S., in the same way it did step up for smallpox, malaria, and polio, that it steps up like it and HIV, that the U.S. does step up. And so the Congress seems very interested in the U.S. not being so weak that it's other countries that figure out these global problems. It creates a vacuum. It, erodes the kind of relationship and admiration and self-confidence people have had in us as a country. And so, I just say, rationality will reappear from someone at some point, and the U.S. will get engaged in its generosity and the world body that is charged with pandemic coordination.
Yeah, I think one thing it's important for the philanthropists on the phone to also know is just that WHO, as Bill said, is on the front lines of eradicating polio. Well, that's important for polio, but why else is it important? Well, when Ebola broke out in East Africa and it made it to Lagos, as we know, one of the most populous cities in the world, and Ebola came to Lagos, immediately those polio resources that WHO had, we had funded, Rotary had funded, immediately those resources got flipped, and that polio clinic got flipped to be an emergency response clinic. And they immediately went out and did all the contact tracing and quarantining. If that hadn't happened, we would have seen so much Ebola be flown to New York and San Francisco and spread all over the United States. So the world got lucky on Ebola. There are other hemorrhagic fevers out there. And so if we don't have a functioning WHO, you're not going to see an immediate response like that.
Yeah, and I think if anything comes out of COVID right now, it's that we are strengthening. There will be a stronger global healthcare system emerging from this. And, you know, again, you guys have been talking about this for years, and unfortunately it's come true. Tell us about, I know, you know, our knowledge partner is the Global Citizen on this event, and you're working with Global Citizen, the European, with the European Commission, Bloomberg Philanthropy, the Global Goal, Unite for a Future campaign, the Giving Summit coming up. Tell us about that and how that plays into everything you're talking about right now.
Well, sadly, the pain of this epidemic, although it's gigantic in the rich countries, including the United States, and it's gigantic in a way that's very inequitable. Inner city students, racial minorities, poorer households. It's even more challenging as you get to the developing countries where their health system is not as strong, their ability to isolate because they have to go out and get food on a daily basis. It's going to be very tough. And so the question, do we pull together as a world to get the tools out to everyone to help them recover from what's happened here? Global Citizen is a great organization that's got artists to come in to express their values about these things, to give a platform to the government leaders who want to talk about their commitments to help out with these things. So, you know, Global Citizen's been absolutely fantastic, and they've stepped up, you know, and here in June, they're going to have a big event.
Well, speaking of big events and big anniversaries, we're running short on time, but right now we're hitting the 10th anniversary of the Giving Pledge, and we have 2/3 of the founders here. Tell us on this, you know, again, there's a lot going on in the world, but I don't want to miss this opportunity to ask kind of your reflections 10 years in terms of how satisfied you are and where you see us going forward with this.
Yeah, I think both Bill and I and Warren, Bill spoke with Warren yesterday. We couldn't be more pleased about where the Giving Pledge is today. We would not have imagined 10 years ago that we'd have this many pledgers from this many different countries around the world.
What's
and
the
I think
number?
I'm sorry?
Where are we? What number are we up to?
I think we're up to 169 pledgers from 28 different places. Is that right?
Yeah, maybe slightly more.
Yeah, slightly more than that. So many of whom are on the phone, including like Strive Misiawa from Africa, and Sarah Blakely, I know you had on. I think the other surprise to us has been the learning that we've done as a community. Like there are some pledgers I know for Bill and I that I just don't think we ever would have met who are doing unbelievable work, say on prison reform, you know, with finesse, and we're learning what they're applying to that area, and we can apply those things to our own philanthropy. So I would say we're all three of us really pleased. The other thing I would say that Warren reminded us as trustees when we spoke in May about our own foundation that I want to say to the philanthropists on this video call is, this is our time. We as philanthropists will be remembered by what we do during this time of this epidemic. And there are so many places you can invest, whether it's in food insecurity in your own city, whether it's helping with race issues, whether it's helping with COVID specifically. We've seen so many philanthropists step up and do creative things in their communities. And even if you feel like you don't know the area that much as you'd like, or it's not quite as strategic as you'd normally like to be, there are lots of places to fill gaps that the government is not filling. And I do think we will be judged based on our time here as philanthropists by what we did during this epidemic to help.
Going forward, have you had any thoughts about linking the Giving Pledge with the idea of Give While You Live and accelerated giving? Because I think, Melinda, it's spot on. You can't look at what's going on in the world now and think that your money's going to be better spent in 10 years. I mean, it feels like a now moment.
Yeah, I think one of the things we put more into is collaborative giving. The Giving Pledge itself doesn't give to any cause. It's not pooling money. But we've seen a lot of the members go into things like Co-Impact, which is international in scope, Blue Meridian, which focuses on the U.S. and poverty, and see that they can learn and get leverage working together. You know, those charities are stepping up to say, okay, given the challenges of the epidemic or the, you know, the awareness of the inequities that are out there, how can they change their program? And so the expertise you get out of collaborative giving we're really emphasizing that, particularly for people to get started out, and therefore to spend a higher percentage during their lifetime.
Yeah, and we're trying to role model that and do it ourselves. It's why we've stepped up with even more during this COVID time. We've also opened up a platform online called The Power Of, where people can go and look with finesse at places that need money in their community, whether that's around race or whether that's around poverty or COVID, or they can even say, I want to go give money in the community that I grew up in, and I want to give back there. How do I do that? So I think there are lots of ways that philanthropists can give right now. And I think it's about all of us role modeling as a community.